guys, firefighter, master medic, Haverly out of Station 4. I'm going to talk to you guys today about the ResQCPR system that we're implementing onto Medic 4 for the next 6 months. It's going to be a trial period on the new ACD CPR device. It's active compression and decompression utilizing the ResQ pump and the ResQ pod system. We've had the ResQ pods before here as a trial period. From my understanding, what this device is, it's actually an impedance threshold device. It actually increases the blood flow back to the heart. The more blood that you apply to the heart, obviously the more venous return that we're getting to the brain, perfusing more vital organs. When these two are worked in conjunction together, it increases blood flow throughout the entire body and increases the chance of survivability. When you use the ResQ pod, it can be placed with a BVM or with the ET tube. Sits directly onto the ET tube or onto the BVM mask. It's used in line with the ET tube. Going to make sure that your capnography circuit is placed right on top of the ET tube. You're going to get your most accurate reading that way. And then the ResQ pod placed on top of the entitled circuit. My advice is whenever you use the ResQ pod is to flip that switch and you get indicator lights on the pod that turn on and tell you when to breathe. They flash every 5 to 6 seconds, advising you when to give a breath. The ResQ pump system, we're used to doing 100 to 120 beats per minute on hands-only CPR, or the 110 that the Lucas provides. The ResQ pump functions at 80 beats per minute. It provides active compression and decompression. So you're actually slowing your compressions down, but when you think about a normal heart rate, at a rate of 80 is normal. When you look at this, it has a gauge on it. It will tell you how deep to compress, how hard to compress, and how hard to decompress. In order to achieve the standard 2-inch compression rate, you're going to hit about 40 kilograms of pressure to get that decompression, or to get that compression. To get the decompression, you're going to provide about 10 kilograms worth of lift. This is just a giant suction cup, just like what's on the Lucas. Places right in the center of the chest between the nipple line, but make sure not to go below the xiphoid process. When this is placed, you want to center over it, keep your arms straight, and you're actually pivoting at the hips to provide your compressions with this. This comes built in with a metronome that provides an up-down sound whenever you need to provide compression, decompression. When you turn that metronome on and you hear that tone that it provides, if you'll just play up, down, up, down, up, down in your mind as you're doing compressions, you should be just about right on track. All right, so the ResQCPR system is going to be packaged in this blue bag. It does have some mild instructions on the top. This will be placed on Medic 4. This Medic 4 is the only ambulance that's going to have this on it. So if you're going to be responding to a call with Medic 4, have the expectations of using the ResQ pump, ResQ pod system. In the bag, it does completely open up. It's got the ResQ pump and the ResQ pod in the bag. After use, the ResQ pod itself is trash. This is not a reusable device. The ResQ pump, however, is reusable, and it does completely come apart. Inside the pump has a diaphragm that you have to take out of the pump in order to clean this fully. Clean the diaphragm, clean the inside of the cup, make sure you clean the handles if it was messy, but just make sure that this is clean and completely ready to go back into service. When using this system, you need to keep a couple things in mind. This system is for use in out-of-hospital cardiac arrest only, not traumatic arrest, not pediatric arrests, adult cardiac arrest only. Whenever we use this system, we need to make sure that we're staying on scene for 20 to 25 minutes, providing high quality CPR with the ResQ system in place. It's going to be hard to want to stray away from loading that patient up and going to the hospital whenever there's a known downtime of just a few minutes, or if they're in persistent VFib or persistent VTAC. But with this system, you're more likely to achieve ROSC in those patients if you leave them where they are and provide high quality CPR with the rescue system. Even at that 20 to 25 minute mark, if they're still in persistent VFib, persistent VTAC, consider your H's and T's and stay on scene longer, providing that high quality CPR with the ResQCPR system. If you guys have any questions about any of this, feel free to reach out to me or obviously the training division. All right, these guys are gonna demonstrate cardiac arrest using the ResQCPR system. Whenever they get on scene, they figure out that the person's in cardiac arrest. Captain Terrell put the end-tidal CO2 on the BVM mask with the impedance device above that. Garrett started compressions with the rescue pump. Maintaining a good seal with the impedance threshold device is paramount when using this system. So once you're in what they call the triangle of life here, utilizing a pit crew method of doing high quality CPR, your secondary provider is providing the BVM ventilations while the airway provider holds the mask still in place and the compressor does compressions. At the 2-minute cycle when they switch, the provider providing compressions will then go to providing BVM ventilation, and the provider doing the BVM ventilation will then switch to compressions.
Switch.
At this point, they'll prepare to intubate, and they'll remove the mask from the BVM, leaving everything else intact, and hook it directly to the ET tube. When utilizing this system, cardiac arrest time on scene needs to stay at the 20 to 25 minute mark or until ROSC is obtained. From here on, they're still going to be utilizing the indicator lights on top of the rescue pod and flash every 6 seconds, alerting them when to provide a BVM ventilation. At this point, that frees up the provider that's providing BVM ventilations and allows for the provider at the airway to take over ventilations, which frees that provider up to either be prepared to switch back into the compressor role or to achieve another task.
The metronome runs in 10-minute cycles. Use that as your halfway point.
All right, let's go over the finer details of the ResQCPR system, the rescue pump and the rescue pod. It's going to be stored in this blue bag. It should be in the side compartment along with the Lucas and the AED on Medic 4. If you are going to be responding to cardiac arrest with Medic 4 and FMA 4, expect to use this system. We're trial perioding this system for about 6 months or so. So anytime you have an arrest with Medic 4, expect to see this system. Inside the bag is the rescue pump and the rescue pod. Along with the Lucas and the AED, the medic crew should grab this bag and have it patient side upon your arrival on scene. This system is strictly for non-traumatic, out-of-hospital, adult-only cardiac arrest. We're going to be utilizing AHA guidelines on what dictates the difference between adult and a pediatric. There is an addendum in place for this system that Dr. Hillis has reviewed and approved and attached to the cardiac arrest protocol that will be available to add to your protocol books on each medic unit. So you'll have a copy of it there, and then we should have a copy of it in the system itself. With this system, you can expect to have extended scene times. Extended scene times are going to be necessary for the efficacy of the system to work appropriately. 20-25 minutes on scene of a cardiac arrest. Utilizing the system during the full arrest is necessary to get the full outcome that the rescue system can provide. With that, dive into the H's and T's, what's actually causing this arrest. Let's find the underlying problem as to why that patient went into cardiac arrest. This increases blood flow to all the vital organs, gives our patients the best probability of survival that we can give them. During this, because you are increasing blood flow, you're increasing that oxygen flow to the brain and to the vital organs. Intra-arrest wakefulness is going to be something that you may encounter. There is an addendum as well for that to provide some form of sedation if that patient were to awake during active compressions with the system. Once you obtain ROSC, you need to remove the rescue pod and stop compressions. The rescue pod, keep in mind, is an impedance threshold device, requires more pressure to initiate that breath. If they're neurologically intact to the point where they're trying to breathe on their own, that rescue pod is just going to make that more difficult. That rescue pod has to come off immediately. If you're to the point where you have no choice but to transport, whether that be one of the situations that's outlined in the protocol that says this patient has to be transported, or if you just simply don't get direction from medical control in order to terminate the arrest, the rescue pump is not to be used during transport. You have to transition to the Lucas device at that point. The rescue pod can stay intact. The rescue pod does work without the pump. Just take the rescue pump off, put the Lucas on, and go forth with your transport as normal. Appreciate you guys' time. Appreciate you guys watching.
Attached here is the addendum that's been approved by Dr. Hillis. This is available for digital copy on the W drive as well as in a hard copy. If you're going to be around this thing, going to be using it, go familiarize yourself with it, get your hands on it, learn how to use it. I appreciate you guys watching. I'm Dustin Haverly. I'm the Master Paramedic out at 4A. If you have any questions, feel free to reach out to me or to the training division.